Shaniel McLeod, the Deputy Prime Minister, Vanessa Simmons, the Deputy Opposition Leader, Janae Smith, the Government Member, Britannia Moore, the Opposition Member, Jasmine Kennedy, the Government Whip, Renee Sewell, and the Opposition Whip, class, please give her a round of applause. We also have past student and current assistant coach of the NCU debate team, Mr. Rasheen Nelson. And our proud Chloe Hansen, member of the NCU debate team and finalist in the NCU Invitational Debate Series. Let us begin now. We're going to hear from our Prime Minister, Amoy Adams.
Honorable Speaker, respected members of the House, good afternoon. Today we debate a motion that touches the hearts and the minds of all of us. This House believes that important decisions about children's health should be made by medical professionals and not their parents. We, the proposition, we firmly affirm this motion, not to diminish the love or the care of our parents, but to recognize that when it comes to a child's health, expertise must guide decisions, protection must be guaranteed, and objectivity must prevail. Now let's get an understanding of what we're putting forth today. Who are medical professionals? They are health professionals who maintain health in humans through the application of the principles and procedures of evidence-based medicine and caring. Health professionals study, diagnose, treat, and prevent human illness, injury, and other physical and mental impairments in accordance with the needs of the population they serve. They advise on or apply preventive and curative measures and promote health with the ultimate goal of meeting the health needs and expectations of individuals and population. Now, a parent is a father or mother, one who begets or one who gives birth to or nurtures a child. So if you're following me, it is evident that a medical professional has the knowledge as it relates to children's health. It is also important to understand what children's health entails. Your child's health includes physical, mental, and social well-being. Most parents know the basics of keeping children healthy, like offering them healthy food and make sure they get enough sleep and exercise. But as it relates to crucial decisions, it is important to leave that up to a medical professional. Let's talk about the expertise. Now, children's health is often complex. Diagnoses are not always straightforward, treatments carry risk, and outcomes can have lifelong consequences. Medical professionals, they dedicate years to understanding how your child's body works. So it is important to leave, you are a parent, well, the person is a parent, it is important to give the medical professional the way to treat your child, you know? Parents, no matter how devoted they are, they lack this specialized training. For instance, decisions around rare diseases or complex surgeries require careful weighing of risk and benefits, decisions that only trained professionals are equipped to make. Consider the role of pediatricians and specialists in treating conditions such as leukemia. These professionals must balance multiple variables: treatment, the potential side effects, long-term outcomes, and also psychological well-being. Education here is also about ethical training. Doctors are trained not only in science, but in the ethics of care. They understand informed consent, medical risk, and the principle of beneficence, doing what is in the best interest of the patient. Parents, they are guided by love or fear. They may unintentionally override these principles. A parent may refuse vaccination or chemotherapy due to cultural beliefs, misinformation, or anxiety. This is why medical education matters. It equips professionals to make decisions grounded in evidence, ethics, and experience, not emotion. Objectivity is my next point. Love is powerful, but the reality is it can cloud your judgment. Parents may be influenced by fear, social norms, or misinformation, leading to decisions that conflict with best medical practice. Medical professionals, they operate under ethical standards, clinical guidelines, and evidence-based protocols. Their role is to act in the child's best interest, guided by science and not emotion. It is important to emphasize, this does not mean we're removing the parents from the process. Parents remain vital advocates for their children, partners in care, and sources of comfort and trust. But in situations where life, long-term health, or irreversible outcomes are at stake, the final responsibility must rest with those trained to make these decisions. In conclusion, children are dependent on our wisdom, expertise, and foresight. By empowering medical professionals to make critical health decisions, we ensure that children receive care that is safe, evidence-based, and ethically sound. Love alone, even though it is here, it cannot replace the years that these doctors have spent in training. And for these reasons, we stand firmly in support of this motion. Thank you.
We would like to thank the Prime Minister, Lady Amoy Adams, who reminded us that the complexities of children's health needs specialized professionals. We're now going to hear from the opposition leader, Ms. Chanel McLeod.
I'll begin in 3, 2, and 1. Mr. Speaker, honorable judges, member of the government, good afternoon. The Prime Minister said parents should step aside because doctors know best. But let me say this clearly. Expertise does not erase parenthood. A medical degree does not replace the love, the responsibility, and lifelong commitment the parents carry from the moment that a child is born. If we follow the Prime Minister's logic, we are not empowering doctors, we are disempowering families. And in doing so, we risk turning healthcare into a cold system where children become cases and not human beings. On this side of the House, we fully respect medical expertise, but we strongly oppose any model that removes parents from the key decision-making about their children's health. We believe in partnership, not replacement. Parents have moral, legal, and emotional responsibilities. Let me begin with the most fundamental issue, responsibility. Parents are the ones legally accountable for their children. They are not the ones who comfort, they are the ones who comfort them through pain, stay up at night at the hospital bedside, pay the bills, and carry the long-term consequences of every decision. To say that medical professionals should make all major decisions is to strip parents of their rightful role in safeguarding their children. Doctors see patients for, a few minutes or maybe hours. Parents know that parents know their children fear, their sensitivities, their cultural backgrounds, and their history. If we remove parents from the decision making, we cannot We are not protecting children, we are isolating them from the people who love them most. Now let's talk about the medical. In fact, their proposal is not only unrealistic, it is dangerous. If we allow medical professionals to make all our major decisions, who checks on them? Who holds them accountable? What happens when a parent disagrees for legitimate reasons? The government is essentially saying, we have no say, their system knows better. Imagine a situation where a doctor chooses a risky procedure because it is the standard protocol, while parents prefer a safer alternative that aligns with their child's personality and pain tolerance. Under the government's model, parents would be forced into silence, and that is not democracy. That is medical authorizationism. Mr. Speaker, the government wants to replace parents with professionals. We want to empower families with professionals. They promote removal, we promote partnership. Children deserve a system where love and expertise meet, not one where expertise pushes love out the door. Thank you.
Thank you so much to our opposition leader, Ms. Chanel McLeod, who stated that the position of the government risks children becoming cases, and a partnership is what should be prioritized. We're now going to hear from the Deputy Prime Minister, Vinasha Simmons.
Thank you, Honorable Speaker. The Prime Minister has clearly established that medical professionals have the education, training, and expertise to make decisions that parents cannot simply match. My role here is to expand on my Prime Minister's argument and to further emphasize the motion. This House believes that important decisions regarding children's health should be made by medical professionals and not the parents. As my Prime Minister emphasized, we are not removing parents from the equation and from the process, opposition. Parents remain vital advocates for their children, partners in care, and sources of comfort and trust. But the opposition will come and say that parents know their child best, or that this motion undermines family autonomy. But let me directly address this. Knowing a child personally is not the same as making informed health decisions. Parents know their child's personality, favorite foods, maybe favorite movies, and daily routines. But parents often make decisions under the influence of fear, cultural and religious beliefs, misinformation, and emotional pressure. We see this in everyday life. Parents refusing vaccines based on conspiracy theories. Parents denying mental health treatment because of the stigma. Parents delaying care because they are scared of hospitals. And even something that many Jamaican children can relate to. Coming to your parents to say something is wrong, most likely physically. And their parents' initial response is drink a cup of ginger tea, go sleep, a call of the phone. When none of these are the problem or the solution. They don't take their children's ill feelings seriously till it becomes unbearable for the child or odd, and even when it's too late for the well-being of the child. Now, these are not fridge examples, these are common. Opposition's world assumes that parents are consistent and rational actors. This is simply not true. There are loving parents who genuinely believe they are helping. and end up making choices that put their children at unnecessary risk. And there are also parents who lack the literacy, emotional stability, and resources to make informed decisions at all. We cannot outsource a child's life to good intentions, opposition.
Point of information.
Points of information?
Yeah.
Not accepted at this time. Good intentions do not cure cancer. They do not treat asthma, and they do not stop illnesses from spreading. The Prime Minister gave you a foundation of expertise. I am showing you the flip side, the enormous gap between expertise and parental intuition. Now, here's where it really begins. Even well-meaning parents can make harmful decisions because they're influenced by religious rules, of course, personal fear, cultural norms, financial stress, or their own trauma. Let's
Point
be
of
very
information.
clear. Accepted.
So, are you saying that, say for example, there's a major surgery for a child? Are you saying that, every major medical decision, which includes a surgery, should be made without parental input?
As I stated and emphasized, we are not excluding the parents from this equation. We're emphasizing that these decisions of the child's health should be made and with the presence and input of medical professionals. Continuing, this means that when a parent's belief children are uniquely vulnerable because they cannot disagree or walk away. This means when a parent's belief is wrong, the child becomes a victim of that mistake. Consider a child who needs blood transfusion, but the parent's religion forbids it. Consider a child with severe depression, whose parents don't believe in therapy. A child with seizures, whose parents insist on just per alone. A child with medical emergency whose parents refuse treatment due to medical fear of bills. In all these cases, parents are not a villain. Let's get that straight. The parent is simply just not equipped emotionally or intellectually to weigh the medical consequences. Doctors, on the other hand, are legally and ethically bound to act in the child's best interest, not based on their feelings, not based on culture, but based on medical facts. By giving medical professionals the final decision-making power in important health matters, we build a system that protects children from both abuse and accidental harm. Now, this is one of the most important philosophical steps that the opposition will dodge. Children are not extension of their parents. They are not property. Children have the right to life, a right to medical treatment, a right to mental well-being, and a right to protection from preventable suffering. Parents are guardians, not owners. Guardianship does not give you the right to deny treatment that keeps your child alive or healthy. Once we recognize children, a child's survival should not depend on what their parents believe that year. We cannot allow a child's fate to be dictated by a Facebook post, a folk remedy, or a religious doctrine. When parents refuse essential treatments or vaccines, it doesn't only endanger their child, it endangers newborns, elderly people, the nation's healthcare system. Doctors making these decisions create a consistent, evidence-based approach that benefits all children and strengthens public health on a whole. Thank you.
Thank you so much, Vinashe Simmons, who reminded us that the parent's personal touch doesn't heal or cure children. We're now going to hear from the Deputy Opposition Leader, Lady Janae Smith.
All protocols observed. The motion, this House believes that important decisions about children's health should be made by medical professionals and not by their parents, should be looked at a bit more logically. just hold it. The government wants to present this debate as doctors versus parents, as though parents are emotional obstacles and the professionals are just pure logic. But the truth is simple. Children thrive when the two work together, not when one dominates. The government's world is one where a parent's voice becomes noise, and a doctor's voice, it exposes them. Let me address the government bench directly. In passing, they would have mentioned that doctors act in the child's best interests because they're trained professionals. Yes, they are trained professionals, and their intention may be to act in the child's best interest, but intentions do not guarantee logical outcomes. Doctors see medical best interests, not holistic best interests. A child's upbringing, mental readiness, spiritual beliefs, and financial obstacles, and none of these enter the clinical calculus. Parents, on the other hand, integrate all those dimensions. So the government's world isn't one of protection, it's one of a narrowed vision. Of course, parents are emotional because, they love their children. But emotion is not irrationality. In fact, a parent's emotional insight often prevents them from harm. Instance, administering drugs. They know when a child is terrified, they know when they're reaching a breaking point, when a treatment will devastate them psychologically or physically. Doctors cannot determine this just from a chart. The government's model goes beyond preventing harm. It removes parental decision. So even when making decisions, parents act irresponsibly. But parents do act responsibly, I'm pretty sure, when making decisions based on their child's care. They are solving an extreme problem with an extreme solution, removing parents from medical care. But we believe in a balanced approach and intervention only when necessary, not all the time. Around the world, the gold standard is pediatric care, is what's called family-centered decision-making, not doctor-centered, not parent-centered, but a shared relation. So if you remove parents from decision-making, you undermine the very partnership that makes healthcare effective. A child does not live in a hospital, a child lives with their parents. So decisions must fit the reality of the home, not just the theory of the hospital. Doctors, or most doctors, cannot be considered as child advocates. Some are just doing it for the job. Not all doctors, I'm sure, really care about children's health. They are clinical decision makers, so parents, however, are the primary advocates for these children. Consider a child with a chronic condition. Doctors rotate, specialists change, but the parent remains the one constant voice for this child. They notice different changes like eating habits, behavioral shifts, pain patterns, signals that no doctor can see in a 15-minute appointment. If the government removes parents, they remove the person most equipped to speak when a child cannot. Children's rights are not protected by silencing parents. Children's rights are protected by empowering parents. Let's imagine the government's world. Now, a doctor walks into a room and tells a parent, here's a decision, and you don't have a say. Do they believe parents will simply accept that? No. Trust erodes, compliance drops. Parents feel suspicious, resentful, and even alienated from their child's life. That directly harms the child. Healthcare relies on cooperation, communication, and trust, not authority and hierarchy. You cannot build a healthy society by forcing families to surrender to the medical system that does not listen to them. This motion gives tremendous power to a small group of people who do not know the child personally, do not experience consequences long term, and are not accountable in the same way that parents are. And it takes power away from the very people who live with the child, comfort the child, support the child financially and emotionally, and stay with the child long after they're gone or have left the hospital or medical care. This is not child protection. This is a government trying to erase parents from medical decisions. The government thinks they're creating safety. What they're actually creating is a system where no one is accountable to families, where disagreements lead to coercion instead of compromise, and where children become medical subjects instead of human beings with families who love them. A point was made to say that parents act based off fear, but I don't believe that they do, because parents help make logical decisions based on the child's state whenever in medical care. We do not deny the value of doctors. We deny the idea that they should replace parental decision. Children deserve both expertise and love, both science and care, both knowledge and understanding. And being realistic, only parents can provide the full picture of a child's well-being. Only parents can carry the long-term responsibility, and only parents should hold the final say unless truly extreme circumstances justify that intervention. This House must reject the government's overreach. This House must defend families, and for the sake of children everywhere, this House must oppose this motion.
That was our Deputy Opposition Leader, Ms. Janae Smith, who said children thrive when both parents and professionals work together. We're going to hear now from our government member, Britannia Moore.
Madam Speaker, honorable members of this House, today as the government member, my role is to extend and deepen the government bench. So the Prime Minister and the Deputy Prime Minister have already established the foundation that professionals has a duty to protect children, and professional expertise must overweigh uninformed decision making. My contribution will add 4 new layers to the debate. So these points will strengthen the government case by showing not only why medical professionals are better decision makers, but why the cost of not allowing them to lead can be dangerously high. So the government opening established that parents care about their children, but my extension explains why care becomes a disadvantage sometimes. For example, let's look at the Gypsy Rose Blanchard story, where her mother, Dee Blanchard, inflicted a severe form of medical child abuse driven by medical illness now called factitious disorder imposed on another, or FDIA. She actively fabricated the induced illness to gain attention and sympathy, and also financial support. So when a child is sick, parents experience fear, panic, guilt, and sometimes anxiety. These emotions we know can cloud judgment and lead to irrational choices. Parents delay care because they hope things can get better. They also can deny surgeries. So sometimes we rather to turn to Google searches, we rather to reach out to the elders, to the grandparents. We look forward to cultural practices because they want answers that can feel comforting. This is not me blaming the parents. It is of our human nature because we would want the best for our child. But human nature is not a reliable medical tool. When a child collapses with breathing problems, a terrified parent might think that, hey, it's just a cold, or as my Deputy Prime Minister had mentioned, it's gas, so you can drink some ginger tea. A doctor does not panic. However, they assesses oxygen levels, respiratory rate, and underlying causes. Clouded judgment is predictable.
Point of
Professional
information.
judgment, not at this time. Professional judgment is dependable. The decision maker should be the one capable of suppressing emotional and prioritizing evidence. Even the calmest, most well-intentioned parent can replicate the expertise of medical professions. However, doctors are trained for years, so they understand exactly what's going on. They'll know what prescriptions to provide. So these diagnostic tools, lab tests, and clinical protocols are what they would use to ensure that your child gets the best treatment. Parents have love, of course. However, love cannot diagnose meningitis separate and apart from a regular flu. Love cannot determine whether a fever is just a fever or it is a bad bacteria. Love cannot interpret blood tests and other scans. So we speak to also real and measurable risks. So parent-led decisions can sometimes Parent-led decisions often lead to medical neglect and sometimes accidentally, and sometimes out of fear. So parents sometimes think...
Point of information.
Not at this moment, please. Many children suffer because parents ignore symptoms, delay treatments, use cultural practices, as I said before, and fear hospitals. Even when the intentions are good, the outcome might be harmful. So this is where the debate moves from the level of the household to the level of society. Parents don't just make decisions for their child. They make decisions that can possibly affect other people's children. So when parents refuse things such as vaccines, outbreaks can occur. So when they misuse antibiotics, drug resistance increases. When they rely on home remedies instead of medical confirmation, contagious diseases can easily spread. Doctors operate within public health systems. Parents can operate just within the households. So public health requires consistency and not just the individual's whims. Every day a parent makes an uninformed medical decision. My major contribution to the debate is that something opening government has not yet discussed. So even when we pretend parents were competent, which evidence clearly disproves, this is a structural problem. Parental decisions are inconsistent and unregulated. So, Madam Speaker, the government bench has shown you today that parents' judgment is clouded by fear and emotions. Professional decision-making prevents harm and medical neglect. Public health depends on experts, leadership, not unregulated individual choice. So for these reasons, we must place important medical decisions in the hands of medical professions, not emotional, untrained, sometimes inconsistent parents. Thank you.
Thank you so much, Ms. Britannia Moore, who reminded us that love cannot diagnose. Debaters, please be reminded that you have 7 minutes with which to present your arguments. The first and last minutes are protected time. You will hear a clap after the first minute and a clap at the 6th minute. After the 7th minute, you will hear continuous claps until you come down. Clear? All right, thank you so much again. We're going to now hear from the opposition member, Jasmine Kennedy.
Good afternoon, adjudicators, judges, my esteemed opponents, and ladies and gentlemen. As the opposition member, my role today is to build on the arguments already presented by the first opposition team, to defend our stance, refute the government's claims, and to extend the debate today with new arguments that show clearly why we strongly oppose the motion that important decisions about children's health should be made by medical professionals and not by their parents. We fully respect medical expertise. We evaluate the years of training and the care that doctors give every day. But respect does not mean replacement. We believe decisions about a child's health must be a partnership between parents and professionals, not a model that causes a lack of parents from key decision-making in their child's health. I will briefly defend the stance taken by the first opposition. Parents have both legal and moral responsibility for their children. Parents know their child in ways no medical chart ever will. Their temperament, their fears, their reactions, their home context, and how they communicate when they're not able to speak directly. Medical professionals are experts in health, but they are not infallible. Doctors can, without meaning to, make choices that fit clinical norms or institutional convenience rather than what works best for one child. Removing parents from decisions opens the door to mistakes and, in worst case, abuse of power. That is why our stance is not anti-medicine. It is pro-partnership. We trust the doctor's expertise, but also insist that parents must remain central and have a strong say in their child's health. Now I will refute the main claims from the government's bench. The government has said that doctors should make crucial decisions because they have dedicated years to understanding how the body works and because parents can be blinded by love and emotion. But we as the opposition say expertise does not automatically replace the lived knowledge parents have about their child. Because medical knowledge and parental knowledge are different and complementary, doctors bring clinical facts and options. Parents bring the context that decides which option fits their child's life based on what they have known from living with their child. Therefore, removing parents from decisions is both unnecessary and harmful. They also said parents lack the technical understanding to judge complex medical choices. But we say parents do not need to be medical experts to make sound decisions when they are fully informed and involved in the lives of their child. Because good decision making is about values, not at this time, as much as facts. Weighing risks, daily quality of life, family resources, and long-term impacts. Therefore, a model that sidelines parents wrongly assumes that technical knowledge alone captures what is best for the child. They also said emotion clouds parents' judgment. Love will make them choose denial or risky alternatives. But we say emotions are part of any human decision, including those made by doctors. Professionals can be attached to protocols, reputations, or institutional pressures. Because emotion is not the only source of bias, and because parents' emotional concern often motivates them to seek second opinions and to push for careful considerations. Therefore, to treat parents' emotions as a reason to exclude them from having a say in their child's life is inconsistent and unfair. There have been several clashes in this debate about expertise versus lived experience, about emotion versus protocol, about legal and moral responsibility versus clinical authority. The government continues to frame this narrative as a clean trade expertise versus outcomes. We frame it as a necessary collaboration. Expertise plus parental insights equals better children's health. Now on to my first argument. Firstly, parental advocacy protects against over-medicalization. Doctors are trained to diagnose and treat, and sometimes that training pushes toward intervention, then watchful waiting of minor adjustments at home would do. Parents are the constant figure in a child's life. They see day-to-day changes and often prevent unnecessary tests or procedures by tracking small trends and communicating with them. Imagine a young child who has repeated stomach pain. A doctor in a busy clinic might order extensive tests quickly. A parent who knows the child's diet, stressors, and response to simple remedies can suggest alternatives, saving the child from needless procedures. If we remove parents from decisions, we risk a system that medicalizes normal variation and exposes children to avoidable harm. This matters because over-medicalization can cause lasting physical and psychological consequences and drains the resources away from children who truly need intensive care. On to my second argument. Parents understand their child's individual learning and communication needs in a way that medical professionals cannot. Many medical decisions extend beyond immediate treatment to include how a child would learn, play, and relate to others after a medical check or intervention. A parent knows whether a child responds to gentle routines, whether a child struggles with loud environments, whether they shut down when overwhelmed, or whether they need extra time to process information. These details can change what the best option actually is. And finally, medical professionals alone cannot manage chronic home care situations for their children. Many serious health conditions require long-term treatment that is carried out at home, such as daily injections, monitoring symptoms, adjusting the diet, or noticing subtle changes. These responsibilities fall on the parents, not on the doctors. Because of this, parents must be a part of these decisions in their children's lives. Together, these arguments show why the lack of parents from decision-making in children's health harms children more than it helps. Over-medicalization becomes harder to challenge, children's personal needs get ignored, and treatment plans become unrealistic in real-life home settings. When parents are not included, the system becomes colder, less flexible, and ironically less effective. Thank you.
Thank you so much to our opposition member, Ms. Jasmine Kennedy, who reminded us that emotions are a natural process for everyone, even medical professionals. We're going to have our last two debaters for this show debates, beginning with the government whip, Renee Sewell.
Good afternoon, adjudicators and audience in person and online. As government whip, I stand with the government bench in strongly imploring that the motion be upheld, that important decisions about children's health should be made by medical professionals and not only by their parents. Today, I stand before you with a great responsibility ahead of me. My job is to refute the opposition stance, identify the areas of conflict, and summarize the government's position to prove to you that the right decision is to uphold this motion. Throughout the debate, there were many clashes. Firstly, the Prime Minister stated that illness outcomes can have life-altering consequences. No matter how devoted a parent's love is, parents' judgment can be clouded by emotions. Doctors are trained not only in science, but in the humanity part of care. The Prime Minister then closed by stating that children are dependent on our wisdom, expertise, and foresight. This is what a doctor gains from years of studying. The opposition leader refuted these claims by saying expertise and medical degree does not replace love. And it was also stated that parents are solely responsible for their children. But what the opposition fails to realize is that we are not seeking to remove parents completely from the equation. Parents are responsible for love and care, while doctors are the ones with the expertise that can take proper care of children from a medical standpoint. The Deputy Prime Minister then expounded on the points the Prime Minister laid out. And it was argued that parents should be vital advocates for their children. However, knowing your child doesn't mean that parents are fully able to make medical decisions. She also stated that parents, due to emotion, don't often act on their children's illnesses, leading to its escalation. An example was given of a child with seizure being denied because of their beliefs.
Point of information.
Accepted.
You keep on talking about fear. You say parents act out of fear, but isn't it a human response that a doctor also experiences while just singling out parents?
Well, while we can't negate that fear is actually a natural human reaction, doctors are often trained to compartmentalize their emotion, and they can operate from an objective standpoint while still being able to relate to their patients on an emotional level. So it's not that we're saying that doctors can't be emotional, but their years of education is what prepares them for moments like those. The deputy opposition leader then refuted the claim, saying that the debate isn't doctors versus parents. It was stated that it is through unity of parents and doctors that children thrive. It was also stated that emotion doesn't equate to irrationality. Adjudicators and audience, the opposition tries to negate the fact that with the upholding of this motion, we build a system that protects children from abuse and physical harm. The government member further expounded and stated that medical professionals provide consistency and accountability. Additionally, the story of Gypsy Rose Blanchard was mentioned, and that is a prime example of what can happen if doctors aren't given some power to intervene. The opposition member then refuted the claim and stated that while they respect expertise, they don't believe in replacement. And it was also stated that doctors are not infallible. Now, while we can't negate that worry is a human nature or that doctors cannot make mistakes, as mentioned by the government member, love cannot determine how high a fever is or the treatment that is required for any illness. Before I close, a question to the opposition. Are you suggesting that love alone is sufficient to make decisions that determine whether a child may live or die? In closing, I believe that if the motion isn't upheld to have doctors make important health decisions for children, then issues will arise from abuse and belief system. The government rests.
Thank you so much to our government whip, Renee Sewell, who asked the question, is love alone sufficient? We're going to hear from our final speaker and the only gentleman in the show debate. We're going to hear from Antonio Edwards.
Adjudicators, my fellow team members, and DCS shirt holders, good afternoon. So to answer your question, we did not say that love alone is sufficient. We propose unity in healthcare. And it is with deep regret that I inform you guys today that the government's proposal is saying that we should leave the health of our children in the hands of professionals who, when our children leave that office, they just close that book and move on to the next. The entire debate revolves around the fundamental question: what a child's health hangs in the balance? Whose judgment is ultimately prevail? The distant medical system or the people who raise them, nurture them, and understand them? The government painted a picture where doctors armed with expertise alone should decide the well-being of our children. The opposition has drawn that this is not merely a technical, scientific issue. It is a deeply moral, legal, and a human one. When we examine the real stakes, that's the real thing that is at stake, the experiences of family members and the gap in the government's logic is clear. That is important decision about children's health cannot be taken away from their parents. Doctors should guide, advise, and inform, but they should never replace the people who love the child the most. We, the opposition, clearly demonstrate the government's proposal fundamentally diminishes families by stripping parents of their rightful authority. Parents carry out emotional, legal, and long-term responsibilities for children. They are the ones who stay up late nights during illness, manage treatment schedules, handles emotional breakdown, and financial and psychological cost of medical decisions that are made by these professionals. The government asks us to believe that expertise alone entitles medical professionals to override all the experience and knowledge of parents.
Points of information.
None taken. We, the opposition, also highlighted that while medical professionals possess specific training, they remain humans and imperfect beings. Their decisions are shaped by, let me take off my glasses, are shaped by pressure, limited information, and professional bias. Yet the government's narratives assume that the doctors always objectively identifies and knows the best opinion or option for children. None taken. That assumption is dangerous and naive. What is medically optimal is not always emotionally, culturally, psychologically appropriate for a child. Parents are uniquely positioned to ask questions to doctors that will overlook them. That doesn't make any sense to me. We introduce an important and crucial extension. The danger of unchecked medical authority under the government's model. The medical professionals gain the sole power to make important decisions. Family loses the ability to question, to contest, or seek alternative approaches.
Point of information.
Go ahead.
So the government stands on the premise that we're not removing the family from the equation. Now parents know their child, and the opposition member mentioned something. So are you saying that a parent can see a fever? You can see a fever, and then beneath the fever there is sepsis or something that is more dangerous. Are you then suggesting that the parent can identify and then treat such the child without any medical expertise?
That's your time.
Sorry.
To continue, the government offers a world where medical professionals dominate and families are sidelined. But the opposition offers a world where medical expertise and parental love work together, ensuring decision reflects both scientific knowledge and the understanding of the child's life. The government gives you authority. We give you balance. They give you efficiency. We give you compassion and accountability. At the end of the day, families must not be pushed aside by institutions. Protecting a child means empowering the people, empowering the future. We know them best. We love them. For all those reasons, we, the opposition, rest our case.
Thank you so much, everyone. And thank you so much to Mr. Antonio Edwards. You realize he had to take off his glasses to see reason in the government's argument. Okay, so we're going to allow the adjudicators to deliberate and come back with the results of this match. In the meantime, we're going to have the videos presented, or they're only going to be displayed online. We're going to have them displayed on the screen and online for your viewing. We're going to ask our adjudicators to be as brief as possible. Thank you so much.
The NCU Media Group and the Department of Communication Studies at Northern Caribbean University brings you The Lunch Bag, a program to leave you full with goodies such as Money Matters, Tiny Bites, healthy snacks, a special film feature, and of course, the main course. This 30-minute delight will leave you wanting more. It's The Lunch Bag, every last Friday on the YouTube channel NCU TV Jamaica at midday. Come hungry and leave fully satisfied.
Tired of long discussions that go nowhere? Well, here's one that gets to the point. The Department of Communication Studies and the NCU Media Group present On That Point, the last Thursday of each month at 6 p.m. on YouTube at NCU TV. Don't miss a chance to see local and international colleges and universities match wit in interesting debates. See you there!
For this section of the program, we're going to have Emphasis Spotlight. This is going to be an intriguing little section to highlight some of our students. First up, we have Public Relations, which is Patrice Zoom. Yes. Good afternoon, everyone. All right, so I'm here with a poem, so I'd appreciate it if you all listen, right? In a room of noise and caffeinated chatter, where everyone thinks their point is what matters, stands a PR pro, clipboard, pen, and glare, trying to bring order to argumentative despair. People, please, let's follow RACE. It's not optional, it's PR's sacred decree. First step is research. Do your homework right. Not vibes, not guesses, not I saw it online last night. The debater smirks, adjusting their tie. Research is cute, but I prefer freestyle. I'll quote Shakespeare, statistics, and random philosophy, all loosely connected but delivered with velocity. The PR pro groans. That's not how this works. You need key messages, not spontaneous quirks. Your points should align like ducks in a row, not zigzag across the room like a political talk show. But the debaters shout, structure, I've got it. My intro is fire, just wait till I drop it. My lines are precise, well, sort of, I think. Okay, maybe my second argument is hanging on the brink. The PR pro clings to their binder of tactics,
filled with charts, frameworks, and color-coded graphics. A is for action, strategies, plans, not impulsively yelling because the mic's in your hands. C is communication. They say with a sigh, speak with purpose, not just to amplify. Your rebuttal should hit like a laser beam flash, not wave wildly around like you're conducting a flash mob dance. The debater shouts back, well, I evaluate too. I check my opponent's face to see if they're confused. If they blink twice or look mildly stressed, boom, that's a win, debate success. But PR pros, oh no, they do proper review. Metrics reports, analytics too. E is evaluation. Did we reach our goal? Or did everything collapse like a poorly planned poll? As chaos continues, papers fly like snow. A spokesperson panics, what message do I follow? A debater responds with dramatic delight. Say everything at once, you will confuse them outright. Meanwhile, the PR pro fixes the mess in a flash, rewriting statements like a linguistic whiplash. Crisis managed, repetition intact, all in a day's work, no applause, just fact. Together they work, though hilariously flawed. One crafts the narrative, the other claps loud. One builds the message with structure and grace, the other battles opponents like it's a dramatic chase. Yet in this strange harmony, one truth rings clear. Whether persuading a crowd or managing fear, you need research, strategy, and points that collide with just enough flair to keep the audience wide-eyed. And if all else fails, they'll spin it with charm. Everything went perfectly. There was never any harm. Because in PR and debating, as everyone knows, confidence wins, whether or not it shows. Thank you.
Good afternoon, everyone. Don't watch the hair, that's why I chose radio. So on radio, nobody can see you. So every debate becomes a performance. But we're a performance in the dark. And that's what makes radio different. This week's spotlight is on how you bring debate to life without a single camera. No lower thirds, no flashy graphics, no dramatic lighting. Just voice, imagination, and creativity. So let me ask, how do you create attention with a slow pause? How do you show confidence with a tone? How do you show emotion with breath, pacing, and sound effects that paint a picture in the listener's mind? Radio debaters build their own visuals. Maybe you add a ticking countdown. Or maybe you layer soft audience reaction. That's because on radio, debate isn't about being seen. It's about being felt. So students, be bold. Stretch your voice. Stretch your sound design. Stretch the way listeners imagine your debate. Make them hear the emotion that TV needs a camera to show. And that is your radio emphasis spotlight.
It's working. Hello, everybody. Everybody good, tired, thirsty, want to go home? Same. Everybody, I am Kania Harriot, a TV emphasis, the best. No questions asked. Don't look at me. Today, I will be sharing with you some steps in presenting a debate for a live broadcast. A professional debate on TV or YouTube works because it feels organized, balanced, and easy to follow. It starts with a clear structure, an opening graphic, a quick moderator intro, fast participant introductions, and then topic-based rounds where each speaker gets timed responses and maybe rebuttals. Near the end, you can add a lightning round or a few audience questions before closing statements and an outro graphic. Strong visuals make the debate feel polished. A multi-camera setup gives you TV students are not feeling me today. Variety. Guys, shot sizes gives you a variety. Yes, a wide master for context and close-ups for each debater with minimal movement and clean cutaways. Graphics keeps viewers oriented with lower thirds, topic bars, and if needed, a small countdown clock. Set design and lighting should stay neutral, and even with symmetrical podiums, a simple backdrop, and flattering lighting on every participant. But the biggest factor is audio. Clean lav mics and confident moderation keeps viewers engaged. For live streaming, tools like OBS or vMix handle switching and graphics. A wired connection plus backup audio are very essential. Literally anything can happen. And finally, a full rehearsal that ensures everything runs smoothly. Guys, choose TV. Yes, we wear black, but so what, guys? Black never kill anybody later.
If debating is the structured exchange of arguments built on logic and clarity, then journalism is the craft of discovering the truth those arguments depend on. Good afternoon, everyone. I'm Shante Porter, and I will be presenting on Journalism Spotlight. So journalism and debating are partners long before we ever stepped foot onto a stage. Both began with research, real rigorous exploration. A debater digs for evidence to build an argument. A journalist digs for evidence to reveal a story. We chase facts, questions assumptions, challenge sources, and follow leads, not because it's easy, but because truth rarely sits in plain sight. Journalism teaches us to think like investigators, and debating teaches us to speak like advocates. Together, they sharpen our minds, train our judgments, and remind us that every claim deserves proof. And why does journalism hold a stronger emphasis than television, radio, or public relations? Unlike PR, it isn't trying to persuade, it's trying to inform. Unlike TV or radio, it isn't limited by formats designed for entertainment or rapid sound bites. Journalism gives us the space to dig deeper, to confront complexity, to analyze what others might skim over. It asks us
Tired of long discussions that go nowhere? Well, here's one that gets to the point. The Department of Communication Studies and the NCU Media Group present On That Point, the last Thursday of each month at 6 p.m. on YouTube at NCU TV. Don't miss a chance to see local and international colleges and universities match wit in interesting debates. See you there.
Serves as further motivation. Dark is the night, I can weather the storm. Never say die, I've been down this road before, I'll never quit, I'll never go down. See, I promised myself that I'll never let me down. So I'll never give up, never give in, never let a ray of doubt slip in. And if I fall, I'll never fail, I'll just get up and try again. Never lose hope, never lose faith. There's much, too much at stake. Upon myself I must depend. I'm not looking for a place to show I'm gonna win. No stopping now. There's still a ways to go. Oh, some way, somehow. Whatever it takes, I know I'll never quit. See, I'll never go down. I'll make sure they remember my name 100 years from now. So I'll never give up, never give in, never let a ray of doubt slip in. And if I fall, I'll never fail. I'll just get up and try again. Never lose hope, never lose faith. There's much, too much at stake. Upon myself I must depend. I'm not looking for a place to show I'm gonna win. When it's all said and done, my once in a lifetime won't be back again. Now is the time to take a stand. Here is my chance. That's why I'll never give up, never give in, never let a ray of doubt slip in. And if I fall, I'll never fail. I'll just get up and try again. Never lose hope, never lose faith. There's much, too much at stake. Upon myself I must depend. I'm not looking for a place to show I'm gonna win.
One more time for that beautiful rendition. Thank you so much. We're now going to invite our chair adjudicator, Mr. Rasheed Nelson, to come and tell us who. Chloe? Oh, he's going to do it from there. He's going to tell us who would have won this debate, and we're going to crown a best speaker for this match as well.
All right, ladies and gentlemen, I invite another round of applause for our debaters. So I'll be sharing with you the rankings for this debate and also the reasons behind the rankings, followed by the best speaker and honorable mention of other speakers. So the rankings as voted by the panel of adjudicators. In first place, we have closing government. In second place, we have closing opposition. Third place, we have opening government. And fourth, opening opposition. We got from side government the idea that medical professionals make the best decisions. We lacked, however, justification for full autonomy, giving full autonomy to medical professionals as opposed to involving parental decisions. Side opposition makes it clear that partnership between parents and the medical professionals is the best way, hence we defend the status quo. From opening government, we get the idea that objectivity is best demonstrated by medical professionals, and that's why we have balanced decisions when they make the decisions. As well as parents are irrational actors, and we see in many cases where their decisions undermine their children's health. Opening opposition responds by telling us that parents are responsible and know what is best, and their love outweighs the training and the possible outcomes of the medical intervention. They also tell us, by setting the context, which we believe came a bit too late, that children thrive best when both medical professionals and parents work together. In response, closing government tells us that parental decisions are unregulated. We got the idea that this is a public health issue, and so it depends more than just a child being treated. It's a whole issue for the entire society when that child is mistreated or not treated any at all. This is an issue that we would have loved to hear some response from closing opposition. It was not responded to any at all. And the implications of that is that when the panel decided to take a vote, we had to vote in favor of closing government because their issue stood and was not responded to. Albeit closing opposition gives us clearly an outline of the pro-partnership idea, and that the expertise of medical professionals cannot outweigh the lived experiences of, or the lived knowledge of parents. They give us the idea that emotions, which we think was brilliant, is not the only source of bias. There are other factors that must be considered, and also there are details that parents alone can provide in this whole equation of treatment for children. We believe those points were very unique and valid. However, they failed to respond to the public health issue, which was clearly outlined by closing government. And for these reasons, we have closing government first, closing opposition second, third goes to opening government, fourth to opening opposition. And our best speaker for this match is Miss Britannia Moore. We also want to make honorable mention of Miss Venetia Simmons. Job well done. Thank you.
Thank you so much to our adjudicators, and well done to our debaters. Well done, guys. That's it for this, our general meeting for this evening. I'm going to wish you guys all the best for the rest of the semester, and we will close by singing the DCS song. Please stand. Ready? 1, 2, 3, go. Oh, they have the, oh, sorry. My apologies. This is the Department of Communication Studies. We have our audio.